Okay, we're going to go ahead and call the meeting to order at 5:30 and start the Strategic Planning Committee with our roll call. When you hear your name, please say aye or here, since I can't see everyone on the screen, and I appreciate your patience. We have Vidal Francis, Greg Evans, Beth Blackwell.
Here.
Heather, I'm sorry, I'm going to pronounce your last name wrong. Heather Buck. Claire Syrett. Gino Grimaldi.
Here.
Pete Knox.
Here.
Rob Zako.
Here.
Scooter Milne.
Here.
And we have, Tiffany is out today. And we have Vidal here. Welcome. Thank you. All right, we're going to go ahead and open up, see if there's any public comment. Anyone in the queue?
Not online.
All right. Before we begin with our staff updates, I have a couple of announcements. Two of our valued members, Brian Marksfield and Tina Thorson, have recently resigned from the committee. We are very sad by their departure, but we understand and respect their decisions and appreciate the time they served with us. We're also going to be doing an activity today, so thank you, Allie. It reminds us to be mindful of wires and owls and whatever other flying things potentially are going to be in the way here as we go forward. There are many cords though and heaters and sound equipment plugged in, so in all seriousness, we'll just be really careful and mindful of when we're walking around. And I'm really excited again, thank you, Allie and team, for the new look that we have for our agenda. It has a cover page, and we're gonna switch over the public comment process, so that'll come up right after we do our call to order and roll call. So, all right, we're gonna go ahead and kick off with staff updates.
All right. Good evening, Chair Jesus and committee members. My name is Dave Roth. I'm the Director of Planning at LTD. Yeah, so as you've noticed, we do have a new format and a few updates for the committee. Things will look a little bit different going forward. Hopefully that's positive for the group. And we've added a new agenda item here around staff updates. So thought this would be a good opportunity just to share some brief updates with the committee and the viewing public. So I thought number one, just share, if you didn't hear, I know some of you were in attendance, that our station modernization project has wrapped up, and we had the grand opening a week or so ago. $3.8 million project included upgrades to the restrooms, new wayfinding, upgrades to the customer service center. Really is a nice new public-facing area. So if you haven't seen it already, take a moment to go down to the Eugene station to check that out. The second update I have for you is that our statewide transportation improvement fund plan was completed, and this is relevant to the SPC because we did come a couple times in the fall to meet with you and share some new project ideas that we were considering, new programmatic or project ideas to include in the plan. And I thought it'd be worthwhile just to share an update that the plan was approved by the board and then submitted to ODOT, and it's sitting in ODOT's hands right now, where ultimately it goes through a staff review and then is ultimately approved by the Oregon Transportation Commission, which will happen over the next couple months. As you know, we included significant funding for service increases for our bus service, as well as significant funding for our accessible services at the district. Some of the feedback that we heard from the Strategic Planning Committee when we met with you in the fall was to focus on core services before we do a lot of new stuff, and I think the plan really reflects that. But it does include some new things, such as funding for a mobility hub site selection and concept design in Florence, funding to upgrade the bike share system in Eugene Springfield, and a number of other new programmatic elements as well that we'll be undertaking, including rural services pilot, which you're going to hear about tonight. The last update I have for you is just that I'll be the staff lead for the SBC going forward. And so I met with Alma and Tiffany, was it last month that we met to do some agenda planning? So we'll continue to do that going forward. So those are my updates. Thanks.
Thank you. Any other staff updates? All right. Well, we're going to be handing the baton, I believe, back over.
Yeah, I think I'll stay up here if we're on to the next item. But I'm going to invite Kelly Clark up, who's with Lane Council of Governments. She's a principal transportation planner, and she'll provide a presentation on the regional transportation plan update.
Thank you. Yes, my name is Kelly Clark. I'm a principal transportation planner with the Lane Council of Governments. And there's like a thing right there. Sorry, I'll try to split the difference there. So I had the opportunity to collaborate and connect with LTD on quite a few aspects of my job. One primary one being the Link Lane transit services that the Lane Council of Governments operates. I'm a co-manager of that service. And then another piece that I work on quite a bit at LCOG is regional planning. And so I'm here to talk about our regional transportation plan update that we're in the middle of tonight. And please ask any questions you may have as I'm moving along here. And next slide, please. Okay, so this project is, I should take a step back. LCOG is also the metropolitan planning organization for our region of Eugene, Springfield, and Coburg, the urban area of Lane County. It's a federally designated entity, and they're required for all urban areas by federal code for urban areas of 50,000 people or more. And so Central Lane is this area's MPO. As part of that, we have federal requirements that we have to follow. And one is updating and maintaining a regional transportation plan. So that's, again, what I'm here to talk about tonight. This plan is required in our region every 4 years, and the update is due by January 6, 2026. And next slide, please. There's several federal requirements as part of this plan, and they're all listed here. I don't need to read them to you, but I do want you to know that the fact that this is a federally mandated plan, that there are certain things that we have to do and things that we get to do as part to kind of represent the community's values. Like I said, it's a long-range plan. It's multimodal in nature, so it's including how do we get around in our region by bicycle, walking, strolling, taking transit, you're driving your own vehicle, how does freight move around, how does it all work together? And that's a plan to try to help all of that happen. It represents a coordinated planning process, which is why we're here tonight. It does represent the region's goals and investments, and it's a minimum 20-year horizon. It's required that we're consistent with all of the region's goals and kind of what's here today. We don't want to be duplicative, but we want to support that. But also, where's the connection with the federal goals as well? So we're kind of at that in-between agency. And it has to be a fiscally constrained plan, demonstrating how is the funding working out. It has a performance-based planning and programming framework, which is another federal requirement that it's asking us to tie our investments with our goals. Are we doing what we say we want to do? And how are we tracking progress over time? That's a new requirement that our last current RTP was the first to address. This updated one will make it a little stronger, is our intent. And then we need to, just to bottom line, we need this plan to keep the federal funds flowing into our region. If we don't have that, then federal funds stop. Next slide, please. And the coordinated planning process that I mentioned, really the core partners are the agencies represented here. LTD, the Department of Transportation, the cities of Eugene, Coburg, and Springfield, and then Lane County. Those are our primary partners. And then the community is our stakeholder. So we want to get a lot of feedback from our community members. But really the core responsibility of an MPO is to represent the 3 C's of planning. So comprehensive, cooperative, and continuing planning. And that's what we strive to do. Our TAC, Technical Advisory Committee, has been meeting for a couple months and includes representatives from each of these agencies helping us guide the project along. Next slide. I do want to touch a little bit too on just how important it is that the MPO and the transit agencies are coordinating and collaborating, not just because it's the right thing to do, but it's also mandated by federal code. And so part of like what I mentioned with a coordinated federal review of programs and operations, the MPO and the transit agency LTD are very integrated in those federal reviews for each other's operations. The RTP specifically needs to accomplish the objectives of both agencies and look at how transit is integrated into the regional transportation network. How does transit contribute to our goals? How does transit contribute to congestion management? And how is it performing as part of the performance-based planning and programming framework that I had mentioned? So it's a really key component to our network. Next slide, please. The RTP's contents, just to kind of give a high-level overview, has existing and forecasted conditions. So one of LCOG's contributions to the region, I guess, is that we look at what are the population, employment, all the characteristics of the region. What are our current conditions regionally? So we have that regional purview instead of a jurisdiction, which is going to look more closely at just what its boundary is. We look at the region and what is not just today, but into the future. So we do a lot of analysis looking at both trends and future conditions where we can drive them to look at what our expectations are for the future and how do we plan for that and expect that, and to ask the question, is our plan meeting those future needs? This plan also establishes the region's goals and objectives. I mentioned the performance measures and targets. We conduct systems gaps and needs analysis through this effort that we'll be conducting upcoming. We do a pretty thorough environmental analysis. It's asking the question is, what are the impacts of the transportation network on the environment, the built environment, and the natural environment, on the key populations in our area? And then we have a project list that's intended to represent all of the projects from local plans. One thing about the MPO is that we don't build any projects. We're just the conduit and the kind of the plan, the kind of the regional compository of all your local plans. And so we want to make sure we're representing those accurately. So we've been working a lot with our regional partners on that. And then we do measure investment of the performance that's upcoming. Like I mentioned, it has a financial plan and then just a final product. I did want to show you what the regionals, the goals that were adopted in the last RTP were: transportation choices, safety, security, and resiliency, healthy people and environment, equity, economic vitality, reliability and efficiency, and then system asset preservation. So they should look pretty similar to a lot of the goals that you see. We are going through a public involvement process right now to make sure that these are still right-sized to our community's values. Are there any adjustments we need to make? I didn't want to bring all of the objectives that are nested under each of these goals in this meeting because there's quite a few, but I can send those out if that's of interest. But they do support kind of what those goals are. So like I mentioned, we are going through, next slide, please, a public engagement process right now. The bulk of that is to guide people to visit our online open house, which is intended to get information or get feedback, how people in the community feel like the system is working for them. What are the strengths, but what are the gaps? What are the barriers? And what are the values that people have? Like, how do they see investments need to be directed? And that's the intent of the open house overall. We use that information to guide the goals and objectives, the investments of the RTP, but we also share that with our local partners who do the actual project work. The open house is open now, and it will be open through the middle of February. And we've been doing our best to get the word out about that, to encourage people to go into the open house and take all of the activities that are in there. We're visiting as many of the local committees as we can. We've been sharing this link on social media sites and trying to to encourage our community-based organization partners to share the information as well. And also we will be sending out a mailer directly to about 2,000 households in the community that represent environmental justice populations. And so that will be going out this week as well, just to try to get some voices that we may not have heard otherwise. And next slide, please. So the project timeline, we've gone through kind of our background analysis and data, evaluated what are our requirements, is always kind of a good foundational piece to our work, and then analyze the existing conditions. We're in this phase now of fine-tuning the goals and objectives and performance measures, again, through this public engagement and feedback that we're seeking. And we're kind of looking to how do we establish the financial outlook. And upcoming this spring, we'll be looking at measuring investments based on what we've heard, and then using the analysis that we have from the existing conditions and future conditions, be able to evaluate performance. And then beginning of summer, summarizing public input, but we want to make sure that we're telling or conveying to those who have shared with us what we've heard. Did we hear you? Did we hear correctly? Is there anything else you want to share? And then working on drafting up and adopting the plan by November of this year. It's due, like it mentioned, in January of 2026, but we're trying to be finished in November before the holidays hit, and we're in a time crunch. That's just a brief overview. I'm happy to answer any questions you may have, or encourage you to take the online open house.
You know, I've got a question.
Of course, I was hoping you would.
The basic question is what, and I'm speaking on behalf of the public, what are the choices that our policymakers are making? You said that the MPO doesn't actually do projects. You reflect projects that are in pre-existing local plans.
Mm-hmm.
But the projects are sort of where the rubber meets the road. And so if you're not selecting projects, kind of how do we tell the public what difference this makes? I mean,
Yeah.
what choices are being made in this plan? Or is it more of a technical exercise that you need to check off some boxes in order to keep the federal funding flowing?
It's kind of you're right, we don't build projects, but we know how to encourage investments. And that's what our policy board needs to hear, is how do we look at where investments need to happen to meet and be connected with our community's values. And that's our role.
I'm not sure that I follow you. Let me see if I follow you. The regional transportation plan documents how projects that have already been planned meet goals that are regional, something like that. I'm not trying to be argumentative, but just there's actual confusion. And I know in the past, it's been hard to get the public engaged in this because the public's not really sure what the public's commenting on. It's kind of really abstract. If you say build this or not build this, they get that. The other stuff is really hard to relate to. And so I'm hoping that you can help me and others kind of connect the public of saying why this is important to engage in.
It's an additive layer for sure. Sure. Oh, there is the jurisdictional plans, and there's the kind of, what is the layer between the jurisdictions plans and the federal government, and that's what we are. So we're looking at what are the regions priorities, not just the local area priorities. But go on.
This is not so much a response to Rob's question, but more so, one of the things I love about this is that, again, the MPO, like Rob mentioned, doesn't necessarily deliver projects, because those projects are actually hidden within the various agencies or organizations that form this MPO, et cetera. But the biggest benefit that I see is the fact that we could leverage each other's organization to help deliver a master transportation plan for the entire community across the board that's part of this MPO. And I think that's part of one of the largest benefits that the community can get. If you're living in Coburg, obviously you may work in Eugene or Springfield or whatever the case may be, because the proximity is so close, just that individual living in Coburg could optimize the use of the plans that are within Eugene or Springfield based on what projects those individual entities are trying to deliver. In other words, I can leave Coburg, get on a car, get to Springfield, get on a bus, get to, and et cetera. And again, that partnership between the various agencies is what brings this is my way of expressing it, the benefit that the MPO actually could do for everyone as a whole across the board from one end of Lane County to the other end of Lane County that comes through this metropolitan area. That's kind of my thought on it, but that's the benefit that I actually love.
Kind of carrying out the 3 C's that we are tasked with. What is the collaboration? What is the consistent messaging? And what is the coordination between all of our agencies?
Gino?
So the project list, is it constrained by costs or?
The expected costs that each agency is expected to bring in over the horizon year of the plan.
So it's self-determined by each agency?
By each agency.
Okay, so the agencies don't have any limits as to what they can put on the list as long as they can somehow justify the revenue coming in for those?
That's how our region, yes, that's how our region interprets that.
I'm sorry.
That's how, so each agency's plans, their transportation system plans, whatever plans that they may have a constrained list as well. And so we kind of like bundle that up to the regional level.
Let's
So it's
say,
constrained at the local level and then at the regional level.
let's say agency X is proposing a project that really neutralizes what agency Y is proposing to do.
Mhm.
Does that discussion occur, and how does it occur?
We'll be talking about the project list and the financial plan for that this upcoming spring. And it is always part of the process. And we respect what each agency has planned for and has adopted as far as what their council says is reasonable over the next horizon year.
So, and not to be critical, I think there's a great opportunity for these partnerships and to work these trade-offs, but I guess I'm not seeing how that can happen. What I'm hearing is okay, LTD is we'll submit a list, and somebody else will submit a list, and here they are, and they're all put together in a plan. Without a lot of conversation back and forth between the agencies about how to make things work in partnership. Is that
There is
right?
an annual conversation about what gets funded as well, and that happens at the MPO level. So that not all of the projects are getting funded. You're right, there's very limited resources, but we have to make decisions about what gets funded and what doesn't with the limited funds that are coming in. And this plan helps to do that because we've established what the regional
The MPO is,
priorities are.
the MPC are the same organization.
Sorry, MPC is our Metropolitan Planning Organization,
Yes.
Policy Committee, and it's the MPO's policy board.
Let me piggyback on Gino's questions, and I've been only doing RTPs for 27 years now, and I don't understand it really. But there's a financially constrained list and there's an illustrative list. So if some jurisdiction X has a bunch of projects they want to do, it's fine to put them all in the plan. What's not fine to do is to put them all necessarily in the financially constrained plan. What I'm hearing you ask is, say the jurisdiction X has a $100 million project and they expect to get federal funding, and jurisdiction Y has a $100 million project, but there's not enough money to both of the two of them. Say, for example, there's Springfield and Eugene. How does it decide which is on the financially constrained list and which is not? If there's not expected to be enough money to do that, how does that negotiation happen? And I haven't seen it happen in public. I hear staff sort of figures that out, and the list comes forward. It's sort of like, well, here's the list. And the public goes kind of like, okay, that's your list. What do you want to hear from us? You've already decided what to build and what not to build. So you're asking, like, is there some sort of prioritization at regional level of saying we aren't expecting enough federal funding to do everything we want? How do we as a region prioritize that some things will get built and some won't? How does that process happen in a comprehensive, coordinated, continuing process?
The next step after the RTP is the funding of the Metropolitan Transportation Improvement Plan.
Well, I get that, but
The MTIP,
before you
which
get
has
there,
the
on the
federal
RTP
goals.
though, there's a financially constrained list and there's an illustrative list. And when you adopt the RTP, you've made a decision on which is on one list or another. And that could change, but you're kind of saying over the next 20 years, we expect to build these things and not those. We forego those. How does MPC or whoever kind of have that discussion of what to prioritize and what not to?
We have a criteria to get a project onto the project list. Does a jurisdiction anticipate that it will be federally funded or have federal funds needed for it? Is it in their adopted plan, or is it a project of regional significance? And those are kind of our 3 layers of criteria to get in to qualify for the RTP. We depend on our partners, each of your agencies, to tell us which of those projects should be in the list.
The reason we're asking these questions is because we care, not
for sure.
being critical. of the process.
No, and it is
Okay.
I don't,
So the project list, is it a list or is it actually prioritized? For example, when I drive the Delta Highway
mhm.
at the wrong time of day, that's a high priority for me because I'm just sitting there in traffic.
Yeah. We have funding like bands of years.
Mhm.
So it's what do projects do? Does each agency expect the project to be built in? So we have bands of 5-year construction,
So
but it's not prioritized as far as like project A1, project B2.
Okay.
Mhm.
And then a question for LTD is how is this going to be brought back to either this group or the board?
Yeah, I'm happy to step in with a couple of thoughts. So right now we're going through the process or have been going through the process of updating our list, just as every agency has. So staff have been working across the organization to take feedback from the different departments whose projects are represented in the RTP. And so we're removing projects that have been completed, and then we're slotting in new projects that have already been identified in the CIP that are not yet in the RTP. So that's the process that we're taking right now. I will say that another project you're going to hear a little bit more about tonight is our long-range mobility plan. Unfortunately, we don't have that project complete today, ready for this round of the RTP, but we will for the next RTP update. And LTD as an agency will be much better positioned to clearly document priorities into the RTP as a result of that work. So I'll say that. The other thing that I was thinking about as we were having this discussion here is that if you look at transit projects, and I think in particular, some of the BRT projects that have happened in this metro region, they're they might be a little bit of an anomaly where it does require the close coordination between a transit agency and the cities, or who's ever the right-of-way owner in this particular case, to come together and prioritize that type of a project and get it onto the RTP for federal funding. So transit is sort of an interesting one there, where you do have multiple agencies coming together, working together to prioritize individual projects. It doesn't get to the bigger, conversation about coordination at the regional level in terms of priorities. But I thought I'd share that out. And I had one other thing I was going to mention, but I lost my train of thought. Maybe it'll come back to me.
Gino and then Vidal.
What's the total budget to do the RTP update over how many years it takes?
Planning
Whatever.
budget or project budget?
Planning budget.
I wouldn't say we have a planning budget. We don't have a cost estimate yet for the project list. It hasn't come.
No,
we're
I'm talking about
building that right now.
there's staff time and outreach efforts and things like that. There's a cost to that. What's the total cost to make this planning
We
effort
have
happen?
3 staff. We have 3 staff working on it, about 0.5 to 0.75 of our FTE over 2.5 years. I don't know if I have a number for that right now, but it's primarily staff time. We have a consultant for helping with some community engagement. That's a $50,000 contract. And then we have consultants helping with our travel model update. And that's a $100,000 contract.
So $500,000 or $600,000 maybe? More than that?
I'd have to look at what our FTE is for each of the staff that are working on it. I don't have that number off the top of my head.
Okay, thanks.
Vidal.
I know that it's to be adopted in 2026, I think is what you said.
Yes,
When's the next time beyond that it gets updated again? Or how long is that interval for update?
it's every 4 years.
Every
We're
4
required
years.
to update it.
Okay, thank you. That's where you can both either add or put off projects on the plan.
Yes.
Okay.
And we can do midterm amendments.
Okay.
And we have, like, if a project is on the illustrative list that Rob mentioned,
Right.
needs to come onto the constrained list, we can amend it in. If it's
Thank
getting
you.
federal funding.
Go ahead, Rob.
So Gino, and I agree. I mean, Gino says we're asking these hard questions because we care. And yet, actually, on some level, I don't care. Because 4 years ago, we really did care. Best did a lot of work to turn out a bunch of community leaders to comment about needing to do more to get people out of their cars to reduce climate change. And at the end of the day, a bunch of people are told, thank you for your comments. It's too late. We can't change the plan, but next cycle around, we'll do that. And it's hard for me to go to people and say, this is really important to comment on, unless I'm confident that people's input will make a difference. And this is not an intended criticism, because a lot of this is federal requirements and there are hoops to jump through and documenting stuff, and that's all very necessary, and that's what we need to keep the money funding, and that's fine. But if we're going to tell the public this is something important, come comment on this, it needs to be important and their voices make a difference. If it's more of a technical exercise, that's fine too, but trying to understand kind of where this is. And my sense is this is more of a technical exercise, that there aren't actually choices being made at this time with this plan. It's more of a documenting stuff. But if I'm wrong, I'd be happy to be told that I'm wrong and understand how there are actual choices being made here.
Would be helpful for us to look at the timeline again, just to see like where that, guys, I mean, sometimes visual just.
It's not the timeline. It's sort of, I mean, we had conversations with policymakers, and policymakers agreed with the public about wanting to do certain things, but were apparently in the process, the choices that were being asked to make, that wasn't the right place to do it. It was sort of like, you need to go back to TSP, and LTD in their mobility plan, or Springfield in their TSP should have done something different, because as Kelly was saying, you know, individual jurisdictions select their projects, and once those projects are selected, that's our given, and the RTPs are documents, all that. There's other stuff in there, but it's a project list. It's saying, we're gonna build this stuff. If we get the money, that's okay. I mean, that's good. But if you know what you're gonna build because that plane's already been done, it's kind of like, what questions are left to ask?
Yeah, a couple of follow-ups. Our last RTP, we did run into a time constraint. COVID hit right as we were starting to update it. We had some consultant issues. We got into a time constraint, and that hurt us in the end, and we had to move the process forward faster than we would have liked as we were talking about the project list. So I own that. I think I also want to mention the project list is not just capital projects. It's our programming that we do at a regional level. The Safe Lane Coalition, which is really active in the community around creating safe programming, safe routes to schools, transportation options, all of the kind of this Walktober, Biketober, all of those kind of programs that are there to encourage people taking different choices about how they're getting around, taking the bus, walking, biking, to help support the greenhouse gas reductions goals that we heard from the community and added into the RTP as a goal. So I think it comes full circle. I think there's connections being made. The capital project list is a little harder conversation because the MPO, like I said, doesn't control capital projects. We do control the programming, and we have a say in how investments are made regionally, because those investments do need to comply and to support those regional goals that we've heard of and those objectives that we've heard of. And so I think that's where the connection is with the community is, while it's not all a plan, it's a region's plan. It's not just the MPO's plan. It's not just City of Eugene's plan. It's not Coburg's or Springfield's plan. It's the region's plan, which is a harder concept, but it's really important to note. And we're here to help have that conversation about how is the region making investments. We don't think of ourselves, I think, that way very often. And so that's a hard conversation for us at the MPO to have and to get that kind of word across. But we do collaborate with our partners, with our agencies on a daily basis. And we want to make sure that we're supporting what their investments are and what their goals and values are. And this is just the plan that does that. And whether, you know, it to some extent, sure, it's a checkboxing exercise, a lot of things that we do are. On the other hand, it's a really important document that we want to make sure we get right. And that does reflect the region's priorities and your agency's goals and priorities.
I really appreciate the conversation we're having. I think one of the things I'm hearing from Rob is, and I think part of this is building trust in the community. Like if you're going to ask someone for their opinion, letting them know, is this opinion on the engagement spectrum? Is this opinion going to inform or make a change to something? Or is this part of it, you know, it's got to be able to report back and say, does what we already built align? And that sounds like what we're kind of looking for. And I think that's an important, you know, being part of the community, this committee of the community, how are we ensuring that we're continuing to build trust and everything? So that's what I'm hearing from Rob. And I think that maybe be part of this conversation to be helpful when we're looking at this in the spectrum. That's why I didn't want to pull up the time frame. I want to be really the timeline.
And I want to compliment Kelly and just sort of close this out. So if I
Okay.
might, yeah, I mean, I really appreciate the work that you and LCOG does, and please take this sort of, we do care. But you're reminding me that LTD recently adopted, is it the community outreach framework that sort of had these principles embodied into it about sort of two-way communication, promises we make to you. If LTD comes to you and asks us things, this is what we're going to do with that. And we're trying to see that sort of same level of transparency with the RTP planning process as LTD is striving for. Is that fair?
Yeah, absolutely, absolutely. And again, it's good. That's why we have
And-
folks here having these conversations.
So a suggestion maybe for LCOG staff and PO staff to take a look at what LTD has already adopted of whether, when you do the public engagement, whether those principles might be transferable or not. Just a suggestion.
Yeah, and as part of our timeline, I don't think that's still up, but we will be bringing, again, what we have, asking the community again, have we got this right? That will be coming earlier this summer as we move into drafting this whole plan up.
Kelly, thank you so much. I want to be mindful. This was a really robust conversation. And Ellie, thank you for keeping the facilitator on time. Thank you very much,
Thank
Kelly.
you.
Really appreciate this conversation. And there's a question. Oh, sorry, it's a little yellow hand. The question online.
Beth.
Beth.
Get myself off mute there. I just want to say thank you for the presentation and actually for the conversation and the questions that were raised, because I feel like there are questions that I had in my mind, and it's always helpful when you see other people's questions and point of view. And I look forward to hearing more about this. Unfortunately, I have to excuse myself from the meeting. As you know, yesterday was a holiday, and so tonight is City Council. So I'm off to City Council. So I have to say goodbye. And I'll watch the rest on video later. Bye, guys.
Thank you. All right, we're going to move on to the LTD Rural Service Pilot Project.
Good evening. I'm Brandon Melton, the new guy, the development planner here at LTD. I've been here for about 6 months now. Tried to introduce myself to most of the folks here, but here I am. Tonight, I wanted to talk to you a little bit about the rural services pilot and what we, why don't we go through 2 slides and get to, there we go. So I want to talk a little bit, just basically what the project background is, how we're looking at different areas that are potentially could be served by this pilot. And then we're going to talk a little bit about what additional planning and public outreach is yet to come. Next slide, please. So, where did this project come from? LCOG engaged, Lane Council of Governments, engaged in some important planning work to produce a rural, the Link Lane Transit Development Plan. That plan outlines several rural communities that would benefit from an on-demand type service that aren't really served by any kind of public transit now. And so I'm going to talk a little bit about those areas. They're kind of listed as priority service areas, but I'll go through each of them individually a little bit later in the presentation. Next slide, please. So that project was identified in the Link Lane Transit Development Plan. And then, we look at it from a lens of our mobility management strategy. So it identifies several opportunities to connect the community. And strategies include analysis of mobility needs, gaps, and highlights the need to increase traditionally underserved populations such as rural populations. A key component of that mobility strategy is understanding how mobility management can fill gaps. And this pilot is meant to expand rural services. It was identified in the STIF plan and was selected for funding through discretionary and formula funds. So project was identified. It aligns with what we've been discussing as part of mobility management strategy. And now it has funding, and we're proceeding with the work to plan that project. Next slide, please. We also have this pilot process identified at LTD, and we're following that. Right now, we are at the planning phase. We're kind of doing planning and implementation at the same time because we're in a pretty short time frame. We need to establish this service by the 1st of July. So we are working on some of the details, but also developing a scope of work so that we can go out for a request for proposals for potential providers for the service. The goal of this pilot is to connect rural residents to services. It's just services in general. That could be connections to medical appointments. It could be connections to existing transit services to open freedom of movement throughout the community in Lane County, and or connections to family members, social activities, really anything. But we want to be able to evaluate how these services are being utilized by rural residents. So we're thinking of that, up front. How are you going to evaluate success for this pilot, and what services might warrant being continued? So we're going to go through a couple of maps here. I'm not going to linger on them. They are in your packet. If you want to look at them a little closer, notice that they're kind of hard to see on the screen, but we'll go through them. These are the first three maps or a couple of the maps in there are from the TDP. The service areas are identified in the TDP. And then the fourth one is one that we've identified as a potential area for service. And we'll talk about them as we go through them. So next slide, please. So the first service area that was identified, and this was, it was prioritized as well. I didn't mention that. They prioritized in the Link Lane TDP from a high, medium, and low priority. Excuse me. And so Oregon 36, really this corridor in the north end is Deadwood, and then it follows Oregon 36 to Mapleton, where it picks up on Oregon 126, traveling all the way to Florence. So that's one potential scenario, is that service would provide a on-demand type service throughout that corridor. Another scenario might be that it collects folks from Deadwood and brings them to Mapleton to connect to existing Link Lane service, which travels to Mapleton it goes through Mapleton, but there's a stop in Mapleton, and there are trips that go between Florence and Eugene daily. So there's a couple of scenarios, and thank you very much. And we're working with VIA to do some modeling for us on what ridership might look like and costs. So we need to identify some of those details before we can proceed with service. Next slide, please. So this slide is a map of the current South Lane service area. You maybe can't see it very well on the scale, but it's a very large area. It's about 350 square miles. So it's a large area, and some of those services go all the way into the Springfield, Eugene metro area. We're looking at refining this service area to create some efficiencies. and bring folks and connect folks to services in Cottage Grove specifically, which would also connect them to our fixed route service. Next slide, please.
Real quick before you
Yeah.
go over that, so I can orient myself.
Yeah.
What's the jurisdiction or the town? or
So in the
area?
center of that is
No,
Cottage.
no, more to
Oh.
that would be to the west, I guess. Is it? I don't know which way we're looking.
Flaggage or whatever that is?
No, I'm looking at the boundary that's on my left here.
Yeah,
Lorraine.
Lorraine.
Okay, gotcha. Now I
Yeah. And that's, so that southern boundary really follows the county line. There's a little jog.
and what's the other corner to the upper right?
In the upper right, well, Crestwell is along the highway there. That's towards the top. And then Cloverdale.
Okay.
Yeah.
That helps me.
Sure.
That blob is hard to do.
Yeah. Yeah.
Thank
It's not an easy one to really convey on a map on this scale. So it's a large area. And so what we're working on doing is there's LCOG has run this service for a number of years now, and they've collected origin destination data. We're going to look at how people are using the service now and better understand how it's being used so that we can refine it and make it a little, better. And next slide, please. The next area is Mohawk Marcola. Again, this was identified in the TDP, and I should back up a little bit. So these areas were identified and prioritized based on a number of factors, including public outreach efforts and who responded to who wanted transit service or access to some form of transit. And so that's kind of how that was identified, but also areas where, there's not as much access to social services, and maybe houses that are either lower income or one or no car households. And so those are all prioritized and identified in the TDP. Next slide, please. The fourth area was Junction City. So this is something that, as staff, we looked at. It has some similarities to Cottage Grove, and the Cottage Grove connector has been a pretty successful service in our minds. So it's probably, as we're prioritizing things internally, it's on the lower end of our priority list. But if we find that we can serve the other service areas and we have available resources, then we would consider also serving Junction City. And we're really looking at, next slide, please. Yeah.
Is that just the urban side of Junction City? Or
Yes. So it would serve primarily the urban.
And that's why
or-
it's pink. So I
Yes.
didn't- Okay.
Yeah.
Thank you.
Yeah, I just wanted to highlight it, and I made it a different color so that it wasn't the same as the other one, so you didn't think it was also in the TDP, but anyway. So just let me know. Okay. So that being said, we are in the process of hammering out a lot of those details. So on the face of it, it seems fairly simple that we would, run buses in these areas. We're looking at, how much it's going to cost to provide service to these areas and how much service we can provide, up by days of week. If we're going to be able to take people wherever they want to go, or if we're going to have to set specific destinations. Because that can increase, efficiency and better serve the rural communities as a whole. There's also going to be some changes to South Lane services. We anticipate that the Cottage Grove connector will continue to operate how it does, 5 days a week. And that's the intra-city service. So you can go from anywhere in Cottage Grove to another area of Cottage Grove within that service area. 5 days a week, and it uses an app, and you can call ahead and schedule trips like that. So that will continue. There's two other services that are currently operating out of South Lane. One of them is a Metro shuttle, which brings folks into the metro area. The other is an on-demand service. that moves folks around. And those both operate on 5 days a week. We're really going to have to redistribute some of those resources to other rural communities in order for this project to work. We need to see, have some equitable distribution through the county, and understand if there's other rural populations that could benefit from this type of service. And being a pilot, we have a lot of opportunity to better understand how those services will function. But tonight we did want to get some feedback from you. We're going to need to communicate some of these changes. We're going to need to communicate well with the folks that are using the South Lane service now and how that's going to change. And we're also going to be coming into new communities. So I think my first question to the committee would be that, what are some things we should be looking out for when we're initiating this service? We have a pretty short time frame to start pushing this information out, and we're still, deciding on details. But is there anything that you would like to see from us as we're rolling this pilot project out?
Real quick, I think we have Gino, Vidal, and then Heather. Heather. Okay, Heather first. Okay.
Heather's
Okay,
territory.
Heather.
Well, thank you. I have a concern of adding additional locations if it's going to take anything away from the current service and service area.
Mhm.
So I just want to hear from you that it's not going to limit or remove current service from its existing areas in order to expand to other areas.
So it's a redistribution of rural services. So in South Lane in particular, they have 5 days of service, whereas in these other areas, there's no service. So part of this project is reaching out to those communities that were identified as, needy rural services, rural transit services, and really piloting to see if that's accurate. So to your question, that service would reduce from 5 days likely to 2 days a week.
So that I have a real problem with. For me, that's really concerning because it's existing service base that I know that is in the Cottage Grove area primarily, right? And I know I think you already have to Florence as well, right? From Eugene to Florence and the South.
So
Lane, too.
that
Those are the
is, so Link Lane does run from Eugene to Florence.
Right.
The community that's not served is the area between Deadwood and Mapleton.
Okay. Because I hear a lot from the South Lane residents that your service currently as it is deeply needed. Now, if you were able to show some statistical data saying that on X day a week, we don't get people calling and needing the service, then I could understand maybe relaying that day to another location for a pilot program. But I'm going to hear it from people as soon as you reduce service from the South Lane area. If it's a popular route or if it's convenient or routine, like people become dependent because they know now that this service is available. They start having routines and regular, transportation needs that they have now relied on. And when that goes away, because of a change like this, that really upends their lives. So have you got any statistical data information showing that going from 5 days to 2 days a week is not going to impact your service customers?
I think a lot of that so we have some data on origin destination. When people are booking trips to and from different locations, we haven't had an opportunity to analyze that closely. But something to consider is that they will still have service. It would just be limited to certain days of the week. So yes, it would likely change, how they normally do things, but they still, have bi-weekly access to some services and critical services, like healthcare and, food access that they might not otherwise have. And having those, even a couple days a week is better than no days a week. So it's still a lifeline service that's available to them. But yes, it would cause an inconvenience while providing new transit opportunities for people who have none now.
And I find it challenging to go from 5 down to 2 days a week and saying, well, it's better than no days a week. That's not, that's not where we want to go.
Sure.
Have you had a direct outreach to your current customers in that current region that shows that
Sure.
their feedback that they wouldn't be impacted if those days were removed?
So right now, Layton Council of Governments, they are the ones that provide that service. And so it would be a new service for us. And you can correct me if I'm wrong, but so that would be I don't believe that outreach has been done so far. So that would be part of this process is understanding that.
Would it be done prior to removing the days of the week?
Yeah, and that's part of the reason that we're here tonight is to get feedback from you on how we have those conversations. We've had some conversations with South Lane Wheels, the current provider, as well as we've had some conversations with like city manager of Cottage Grove, just at a high level as we were putting this together as part of the STIF discretionary ask. So this was something that we talked about when we put together the discretionary request for funding. And I think this highlights one of the challenges that we have when we do pilot projects, because the current service is a pilot project, which was a limited duration service. And I think this is something that John helps remind us that we will always face this challenge when we do pilot projects. Is it sets up the expectation that there will be a continuation and perpetuity, but that's not how pilot projects work. There is a change that's going to happen on July 1st where the existing service no longer occurs, and we need to be positioned to put the new service in place. And we are proposing a new pilot project that's funded by STIF discretionary funding to take some of those current days and put them elsewhere in the county. Granted, and we definitely acknowledge this, that this is a big impact to people who are utilizing the service in South Lane outside of Cottage Grove. But it is an opportunity for us to test this out in other locations. There needs to be really close coordination and communication with those populations. And even we've talked about talking to some of the healthcare providers to understand what are the days that people are using that service to get to appointments? Is there even flexibility to change the service hours provided by service providers to align with the days, the new days of service? And just to be clear too, if it wasn't clear, Brandon was talking about consolidation of some of the services. There actually will be increased service within Cottage Grove as part of this reconfiguration. So we are talking about the rural outside of Cottage Grove service area,
Right.
Just to make sure that that's clear.
Do you have a way that these people call in to utilize the service, so I'm assuming that you have some kind of contact information for the users available. I would just highly suggest that you reach out to each of those users directly rather than relying on the city manager's assessment. South Lane Wheels will certainly have good input, but nothing's going to be better than getting the feedback directly from the customers you already serve, who are going to be most impacted with the change. Thank you, Chair.
Thank you. And we have a couple of, we have Gino, then Vidal, and Rob, and Scooter.
So I share Heather's concerns. You know, the one that comes out in my mind the most is, you know, when I go to make a medical appointment, I'm not given a lot of options. And if I can't take the day that they give me, I'm kicked out a month or so for something that I want. So by moving things from 5 days to 4 days, it could have a significant impact on people in their medical needs. I had a question, but it's kind of moot given this part of the discussion. But I think at some point, when we have the resources, it'd be interesting to look at Lowell, Dexter, and Fall Creek as an area to serve. But I don't think that's within reach at this point in time.
Thank you, Gino. Phil, and then Scooter, then Rob.
You actually answered my question in the discussion there with Commissioner Buck here. So this is a tough situation. You know, it's hard. You know, and I'm sitting here thinking, my gosh, how could you? What we can do to make this work? You know, hearing the concerns, because there are folks out there, like everyone kind of mentioned here, that look here, I'm dependent on that ride at 9 a.m. or whatever time it comes. And even if it's just 3 days a week, and if you take those 3 days, oh my gosh, and you give them the other 2 days, that's really not going to work. Okay. But I'm thinking what would be the best way to, from lack of a better word, clean this up. That's my way of expressing it. And the only thing I can think of right now, and again, this is not a solution, I think that if we more than likely reach out to those folks who are actually using the service, kind of like what the commissioner just mentioned there. And I don't mean just reach out to them the day before you decide to do something different, you know, months in advance. And what I mean by this reach out to is to give them an opportunity to say, hey, look, you're saying you need to do this. Ask them what would work for them, you know, and again, that, yeah, I don't know how much notice that is. 5 months, 4 months.
I think that's a great suggestion. It's going to be extremely challenging given the timeline that we have until July 1 to implement some kind of service. So if we reach out and I, you know, start tomorrow and I, you know, do a mailer or some kind of outreach, we would have to decide how we reach out. You know, how long do we give them to respond? Is that a month? And then, you know, we have to develop a scope of work to put out an RFP to contract with an operator. We really start bumping into that timeline where, you know, service will end. So we really have to stick to that July 1 deadline. So we hear that, and it's going to be a challenge. And I think we need to, understand how that's going to impact the timeline and of developing our request for proposals for operators.
Yeah,
I'll just step in and I'll just say that we will commit to reaching out, and we'll work with LCOG to get the contact list and make those phone calls. So thanks.
Thank you, Rob, and then Scooter.
I appreciate what you're trying to do. There's an equity issue here. So people in Cottage Grove right now have 5-day-a-week service, and people in Mohawk have none. You know, so if people in Mohawk want to get a doctor's appointment, they're just out of luck. You know, and so can we sort of balance that out and spread it out and take some of the stuff that's been applied to Cottage Grove? It was a pilot project. It wasn't guaranteed to be forever, and reallocate it and sort of try that. That makes sense in an abstract level, but I think, and these are your people, you know, you give somebody service for a trial period, 6 months, a year, whatever it's been, you know, and whether you said it or not, the intent is, you know, if it's successful, you know, if it's working, if it's being used, then you did a trial, it's working, so you continue it. You don't try it, it's working, you take it away. And so reducing it from 5 days to 2 days is kind of saying, this was an unsuccessful trial. We tried it in Cottage Grove and nobody really needed it. Whether that's true or not, that's sort of the message it sends. And so I tend to agree with others who are saying, you know, yes, we want everybody to be served, but it's much harder to give people service and take it away than to not have in the first place. what I would suggest, as you know, is assuming that a state transportation bill is passed this session, part of that, it's highly likely that there's going to be a significant increase in STIP funding. And so maybe it's a question of timing of, do these pilot projects elsewhere without taking funding from the existing pilot project? If that's successful, continue in Cottage Grove, but plan not in fiscal 2025-26, but maybe a year or two after that to say, let's take some additional funding and try some pilots in other places. Thank you.
I think that's great feedback. I will make a note that this was discretionary awarded funding for a new pilot starting July 1. Technically, we have no funding identified in the formula plan right now. So you can understand some of the challenges there. Yeah.
I'm gonna let Scooter go real quick and then I'll get back over to you. Scooter, go ahead.
Pardon my voice. I've been under the weather. I just wanted to make a suggestion, at least for the Florence area. I know the LCC campus out there is pretty involved in the community, so they might be a good point to reach out to directly as far as getting a feel for their students and employees' needs for transportation. And it's entirely likely that they already have a list of, hey, this is what our folks say is working and what would be better. And then just to further hop off of that idea, for any of the other areas under consideration, to reach out to the organizations and employers that already use the services a lot or are likely to if they were to be expanded or affected, not just, like previously mentioned, like medical facilities, but beyond that as well, because people need to get to work too. So it's just an idea on that.
Thanks, Scooter. Badal?
Just a quick comment. Really, I want to, and I think everyone kind of feels the same way. I want to applaud LTD for trying to make a difference here, because myself, I live in a rural community and I know how tough it is to get from A to B and how difficult it sometimes can be. Even, 3 o'clock in the evening and you need to get into town by 5 and you got to wait. Okay, it's going to be tomorrow morning at 7, But I do want to say thanks for attempting to make a difference, especially what you've done with trying to provide some level of service that you've already did in these rural communities.
And I apologize, I can't read the name on the screen right now. Go ahead.
Alma, did you mean?
Yeah, there you are, Tiffany. Go ahead. Sorry.
I know my hand is blending in with my background.
Yeah, I'm sorry. And I don't have the right glasses on. Go ahead, Tiffany.
You know what? Thank you so much for the presentation. The thought that comes to me is like, this is a really difficult situation and it's going to be challenging, but in thinking about before the pilot was implemented, there was somehow people met those needs some way. And so it might be worth spending a little bit of time trying to extract that from the folks that it would directly impact, is kind of like before you had this alternative that seems to be working for a lot of people, how did you meet those needs? And, and just trying to figure out maybe if there's a way to look at other options and help facilitate that. Is just all I think of. But anyway, thank you for the presentation. I really appreciate it and all the discussion around it.
Thank you. Thanks, folks. And I think also it was mentioned, Scooter actually mentioned, if there's any opportunity to reach out to other community building organizations or nonprofits or folks, you all know that, but we're happy to help. Thank you so much, Brandon. Your first 6 months here and now your presentation to the SPC. Welcome. Thank you. We do appreciate it very much.
All right,
Thank
great.
you. All right. And next, I want to be mindful, I think we had a robust conversation in the other 2 topics that we were just discussing. Dave has a SPC 2025 work plan opportunity. We did allocate 40 minutes for it and you have 20, so I want to be really mindful about that. So I'm gonna pass the baton back over to you for the next steps.
Okay, I'll do the abbreviated version for you tonight.
And was the, is the time, again, I just want to be really mindful on how much time you put into this. Is the time?
Yeah, I
gonna be
think
okay?
we might maybe not do the activity. I think what I'm really hoping to get out of this tonight is I'm looking for some volunteers to form a subcommittee pending approval by the board to meet in between this meeting and the next meeting to sit down with me and hammer out a work plan. So that's really what I'm hoping to get out of this. So we can not do the exercise. We can do that separately some other time or by email. Does that sound good? Okay. All right, we will do this initial future vision activity though. We can do that. But this is our agenda. Just want to talk a little bit about the bylaws and membership, developing the 2025 work plan for SBC. I'll give you an overview of our planning projects, both at LTD as well as some of the other things that are happening within the community. And you did hear about the RTP from Kelly. So thanks to Kelly for that. And then, yeah, we were going to do this exercise around goals and objectives for SBC, but maybe we could figure out another way to do that if we don't have time. So let's start here. Next slide. All right, so I think you've all heard about our long-range mobility plan, and that's a project that's going to be coming up in the coming months, and this will set the agency's priorities going forward for the next 20 years. And it will give us a chance to really do in-depth planning work around our fixed route system, as well as future on-demand rural services in the future and how we fund those more on an ongoing basis. So we're not reliant on pilots necessarily, really allow us to get into some meaty issues. Anyhow, one of the things that a typical long-range plan will have is a set of goals and policies and a vision statement. So just as a little bit of a warm up, and you'll be pulled into this later, I thought it might be helpful just to go around the room and maybe on screen here, talking about thinking about the future. So 20 years from now, it coincides with the plan horizon for the long range mobility plan 2045. Think about if LTD has implemented and or made significant progress on all the goals, policies, and investments that are identified in that plan. And we're successful at doing that. What is your day-to-day mobility experience like in Lane County? And I thought we could just sort of go around the room and share your thoughts.
So do we want to start online? So Tiffany, would you like to kick us off with any of your thoughts while we ponder over here in the room?
You don't show your.
Oh, wow. What is your day-to-day mobility experience in Lane County?
How do you want to get around in 20 years?
Yeah, I'm like pondering this, and I'm also kind of channeling the world that I live in, and I'm exposed to a lot of different opinions from the business community on a day-to-day basis. As I think about this, I think about where we're trying to go with our and I'm thinking about Eugene, so I bet this would apply to Springfield in thinking about how we're looking to densify our core cities and where our population growth is going to happen. We need better options that connect people to areas where they may not have the best opportunities to have a single occupancy vehicle. And so creating an environment that folks can really experience, whether it be visitors or, people working, people living. We're also trying to put a lot more people in our community cores. So I'm feeling like, having to meet those needs and address those needs for, what we expect to be much more densely populated areas. The end. Sorry.
Thanks, Tiffany. We'll go ahead and continue on with folks online. Scooter, do you want to go next? And then we'll have Vidal, and we'll just go along the process here.
I mean, my generation was probably flying cars by now, but barring that, I really like all the ideas that have been going into the different ways to connect mobility and transportation, as far as like integrating bicycles and some of the online rideshare programs that integrate with Link Lane and such, so that, you know, maybe a bus isn't the best idea, a fixed route bus isn't the best idea for this particular trip, but hey, I've got, you know, another couple options that I can connect with whenever necessary, and just expanding on what's working right now. You know, if it ain't broke, don't fix it, but we can always add and experiment, and I like a lot of the things that are going into it now, and I'm hoping that momentum keeps going.
Thanks, Scooter. Vidal?
All right, I wasn't prepared for something like this, but I'll give you the best answer, at least off the top of my head. You know, we live in a changing world, and you know, I think more importantly for me is that LTD remains nimble and be able to adapt to what's ever coming ahead. That would imply you doing what's necessary to see what's new, up and coming, that could impact what type of services that you would be providing, whether that be electric buses, whether that be like was mentioned earlier, flying saucers or what's not. You know, I mean, for me personally, or how I can say, you know, in 20 years, I would assume there'll still be cars there, because, you know, I like my 1957 Chevy. I mean, it's a classic, you know, but I kind of think that there'll still be cars out there, maybe differently operated or differently used, but there'll still be folks who want to do something on their own or what's not. Same thing with bicycles. I think all of that, the challenges that we face right now, we are actually going to still be facing those as we move ahead, with the exception of some new or enhanced vehicles or buses or what's not. So being nimble, being able to adjust to those things that come up ahead, being adaptable, I think would be very, very good. And I like the idea of you exploring the, and I think it was mentioned earlier too, about the different options. Again, you know, even bicycles are changing nowadays. I mean, we've got e-bikes that are going 10 miles an hour, and that by next week they'll be going 30 miles an hour. So it's, you know, how can we adapt to the newer technologies that are moving us, where LTD could capitalize off of? And that's that conversation about being nimble, being adaptable, and continue doing that work of reaching out to see what changes the community are experiencing, so that you can adapt to those changes or be able to supply the needs of those challenges that they have. And again, that's the best I can say for right now, because it's 20 years is a long time, but at the same time, bureaucracy is slow. Things take time to actually make changes the way we want to. I mean, I got bridges out there. It's 15 years in the making, you know, and still can't even get things kind of moving to where I think it needs to be. But again, that's just my thought off the top of my head. Sorry.
So I really would hope that I could be beamed somewhere, but 20 years isn't that far away. So I'm not sure the technology is going to happen. And it would be pretty cool to put banana peels in my EV and I'm done. But I'm not sure the technology is going to be there in 20 years either. To be more realistic, I'd love a bus that goes down Lorraine and Bailey Hill. There's just no way for me to catch a bus. And I live in a rural area that was not identified in the last presentation. And I would like a reliable mobile app to get a Uber-ish that would come out to a rural area. That'd be pretty cool because right now that's not a service area that they would do. And it would be nice from a mobility perspective for like services to come to you at your home. For example, if you need a nurse, grab your app and they come out to your house and help and serve you. Or just thinking about providing services in a different way that isn't always, the onus isn't always on the individual to get to that service. And we think of it in a totally different way in which the service providers have to find mobility needs to come to the individual.
I don't know that we need to reinvent the wheel. It's not that Lane County is that different from anywhere else in the world. I think there's a hierarchy of needs, which I would call accessibility, connectivity, and reliability. At a very basic level, I want to be able to get somewhere. I think you mentioned Dexter. If I don't drive, I don't think I can Dexter right now. I just don't have access to Dexter. So at a bare minimum, be able to access places that people want to go to. Maybe it turns out that there's service to Dexter, but I have to take 5 different buses, work with 5 different companies. And in theory, I could get there, I have access, but the connectivity, the seamless as such is that I have to have like 5 different schedules. I have to make the connections, I got to wait. And although in theory I could get there, practically speaking, it's not practical anymore. If I have access, if I've got connectivity, but I've got that doctor's appointment and the doctor expects me at 2 p.m., if I can't rely on it and I don't show up until 2:45 and the next patient's already there, it's not worth anything to me. So I need the reliability. And there's sort of a hierarchy there of sort of basic needs. Fixed route service or even on-demand service, can serve a lot of people. And if you have a lot of people going the same ways, it's got advantages, but it falls down in some of those ways. I mean, there's bike share, for example, for some trips. You don't have to look at a schedule. There's a bike here, there's a bike there. For a certain service area right now, for people who can use that, that's in some ways, for me, it's in some ways preferable to traditional transit service. So I think that we should look not assume that a particular mode's the answer, but what is the best technology? What is the best mode to provide that accessibility, connectivity, and reliability? Thank you. Sorry, I didn't mean to cut you off.
You didn't. We're passing.
I just trying to.
You are all good, Rob. What everyone else said, and thinking of my personal day-to-day mobility experience and what I would hope for others is my calendar of events or activities, or the doctor sends me a calendar notice. I don't have to, like, my mobility options my trans options are kind of listed there. Like I can take my bike over to the bus stop and then I can hop on, it'll tell me, hop on the 12 and go over here and hop off of this. So this is what the future, what I hope, what it looks like. And then that removes many barriers for other folks too. So like in making a doctor's appointment, these things are all just like embedded. And again, trying to utilize technology. Yeah, very seamless. So all your different options and then you can cater it to yourself too if you need additional services and support. So trying to follow the assignment, but I'm not as smart and have all the things everyone else does, but I'm like, oh, I like that. It just needs to connect to my phone so I don't have to think, and I don't have to, using a car will be the secondary piece. Like my goal would be, I don't have to worry about having a car and I can be more connected to the community by talking to people on the bus or riding a bike.
So I'll stick to the theme a little bit. That's multiple transportation options. Right now, if I want to go someplace from my house, I really have 2 options. One of them is not very good, and that's unfortunately the bus, because I have to take a long walk down the hill and then I have to go back up the hill to get the bus. But multiple options are great. I mean, we've all been in places where, you go to try to go someplace and you say, well, I can take a boat, I can take a train, I can take a bus, or I can take a trolley. That's all in one location. That's where transportation systems work well. I would like my neighbors to have the same thing that I'm hoping for. And that's, people have access, more people have access to multiple transportation options. So it's not just about me, it's about the entire community. We can't just cherry pick certain places. And woven into that whole thing is that anytime I take something other than an auto, I want that time to be lower or decrease from what it is today. Right now, the time to take, public transportation and the time to take, use my car, there is a big difference between those two times of travel.
I'm gonna add to this conversation and kind of drop it on its head a little bit. I hear everybody who's talked before has talked about kind of danced around the idea that we have this first mile, last mile problem, essentially in transit. If you live along a major corridor like I do, I chose to live where I live because I knew someone was going to build an MX line around it. But if you live in the middle of like a neighborhood like Gino here does, what he's alluding to is, how do you get to that transit easily? And my hope with mobility as a service is to look at how to leverage the new technologies and other ways of doing things to kind of help over the long term. I don't expect it to be today or tomorrow or immediately tomorrow, but how do we help bridge that gap between where running buses regularly down a corridor solves the reliability problem that Rob was talking about, but also being able to get people who might live more than a quarter mile, which is kind of that expected walking distance to a bus stop. So that's that first mile, last problem is what I focus on when I think about mobility.
Thank you all, and thanks for those online. This is great. This is going to be a little bit of a preview for Brandon's work on the long-range mobility plan. We'll be taking what we heard tonight, and we'll be doing more of these activities with the community as well, the broader community, to help refine our vision and goals and policies for that work, and then also our investments. I think we only have a couple minutes left. If I could just run through a couple things before we get out of here. Is it okay if we have just a few more minutes? I'm going to go fast.
I think Commissioner Buck needs to leave a little bit early too, so, yeah.
Okay. Thank you, by the way. That was great. It was good to hear the variety of ideas from you all. It's great. And I think it's very in line with what we're trying to do here as an organization. So the next slide I had was talking a little bit about bylaws and membership. And I'll just stop here and just thank Kelly Perone, who put together notebooks for you. So you get to take something home with you if you came tonight. This has your bylaws, membership roster, a bunch of information. And I just want to make sure that we have these physical items. I know it's not something people use so much these days, but I still like sort of the analog way of holding on to things sometimes. So anyway, I'm not going to go through the bylaws, but I will just say, Alma brought this up earlier. Yeah, we'll hand these out before you go. And we'll get those to the folks who are not able to join us in person tonight as well. But the reason I wanted to talk about bylaws was because we did lose a couple of members recently, and the bylaws do talk about representation and group makeup. And so what I'd like to do is work with Alma and Tiffany, the chair and vice chair, to think about how we go about recruitment. So we will be posting for these positions that have opened up. So I propose that as something to do. And then my other proposal here is regarding the subcommittee to develop the work plan. We could go forward to one more. Here we go. Okay, so you have this in your packet, so you can read through this in more detail. Hopefully you can see it. I know the text is kind of small, but I wanted to give you a view of some of our priority projects over the next year or so. And we've got a lot. One of the things we're doing right now is we're sort of right-sizing the amount of projects we can do with the amount of staff people we have. And so we're doing that in different departments. And so this list, these are the priorities, but it might shrink a little bit just depending on how many resources we have to put towards it. But here's just a few of the high priority ones that SPC may have involvement in. And this is something I'd like this subcommittee to help me think about how to involve and engage the SPC. Are you not seeing it in there, Rob? Okay. Oh, it's a handout. Okay, we'll make sure you have it. But anyway, the long-range mobility plan, that's going to be a really big one for the organization to take on. And this is going to be something that we want the SPC to have a significant role in. We're going to be updating our coordinated human services plan. This is a plan that has not been updated for a while, and it's time for an update. And this is oh, you got it. Okay, good. We're actually going to have LCOG be our consultant on this project, and this will involve a lot of engagement with service providers and how we can better meet the transportation needs, mobility needs of their clients as well as the organizations. And just to give you a sense of this plan, some of the projects in here, it does identify project needs, find their way into things like our STIF formula plan. So this is a pathway for projects priorities to get into the STIF plan through this particular plan. One of the things I'd really like to engage SPC early on is our next STIF formula plan and our next STIF discretionary ask. So I'd like to get more of a head start this time around. So we actually start the planning work in the off year in the STIF biennium, so that by the time the STIF planning work comes around, we're really well aligned on projects. And we just, I think, feel more confident about what we're submitting as part of our STIF plan. And it allows more coordination with other entities and agencies. We're going to be embarking on a fare management, fare policy study. This will require, thank you so much, Heather. This will require, for sure, engagement with SPC, some big, meaty strategic questions and conversations that we'll be having during that process. And then finally, the service policy update. So we have an established adopted service policy that talks about things like how much resource do we put into urban services versus ridership driving services versus coverage services. It might not have very high ridership, but they have other outcomes that we're trying to meet. It also talks about how, when we're adding service, how we go about doing that. And if we're taking service back, how we go about doing that, among other things. As we update that policy, we'll be looking at some other elements like more detailed stuff like stop rebalancing. So are there opportunities where we can rebalance stops along corridor to improve access for passengers, but also speed up the buses, create a more reliable system. So I'm just highlighting a few. There's more on the list, but these are the things I'd like to go through with the subcommittee and think about how the SPC is engaged and involved in the work plan. And then just a note, we're not the only agency doing work, obviously. We heard about the RTP tonight and the other good work that ODOT and the cities are doing, counties doing, and there's a lot happening. There's the climate friendly and equitable communities rules coming down from the state. What does that mean for the cities, and what role does LTD play? The RTP update, which we heard about tonight, Eugene is going to be updating their comprehensive plan. They're looking at urban growth, their urban growth strategies project. They're going to be updating their TSP. They also have a Safe Streets and Roads for All grant that's going to be looking specifically at transit access. Springfield is also updating their TSP. They're doing a bike ped master plan. They're also thinking about Glenwood redevelopment. There's things that are starting to pick up there. What is LTD's role and what's SPC's role in those sorts of things? So that's just a preview. So, and that's where I'll end tonight, but I am looking for a couple of volunteers, and I'm open to, if the chair has ideas on how this could work, it could be the chair plus a couple of others, or, however we want to do it. But I would like to meet at least once in between now and our March 4th meeting.
Yeah, thank you so much for this. And I think if there are folks maybe that are interested in right now, and I recognize too, there's a few folks who aren't here. Do we want to have an email also that could go out to
would
folks
be
and then check in and just maybe we can give us the guardrails so that we are able to be available during that time and make sure that the folks who are interested in participating will know what the expectations are and the time frame so that we can jump in. So, yeah.
May I?
Yes, absolutely.
I'd be happy to serve on a work plan subcommittee. I suggested or asked about having one several months ago. It would be remiss for me not to, participate in that. I think it's important work. I'd also suggest they're independent. I mean, they're separate activities, but I think that having a work plan may help drive the membership discussion. I think it's hard to recruit people to this body if we don't really know what it is we do. We haven't had a work plan. I think having a work plan sooner rather than later and be able to say, if you sign up for 2 years, these are the things you'll be doing over 2 years. This is really important to the community and to LTD. In these ways, you'll be having this impact, makes it much more relevant than just saying, will you serve on some committee? We're not really sure what we do.
That's a great insight. I also mentioned one thing that Alma and Tiffany and I talked about was doing a retreat. So I think we would talk about where that might fit in as well, an SBC retreat. And I think we time it maybe when the new members come on board is what we talked about.
Yeah. Yeah, Rob, it was like you were hanging out in that conversation when you were having the spine. So, yeah, meaning that our team is really good about listening to the needs of the community. So we appreciate that. Anything else?
Well, I mean, it's up to, he was asking what the chair wants to do. It's up to you, but if the chair is going to be involved in chairing and membership stuff, I think that's sort of enough. There aren't many of us on this committee, but it's certainly good to share the load. So maybe people who aren't involved in other ways might be approached who are not here tonight if they want to participate.
Yeah, absolutely. So I'll look forward to, we can get an email out. The team can get that out to the whole committee with sort of what we talked about, those guardrails of what the expectations are, and then figure out a date.
Okay.
So, yeah. And there is Tiffany's hand is up, and I can see that
Can
now.
you see her
Go ahead,
hand?
Tiffany.
I know, I'm sorry. I
Holly.
need a better background, don't I? I was just gonna say, I would really like to serve on that if there's room. I'll just put my hat in the ring now, but I'm certainly open to if the chair has a desire to kind of appoint folks or however you want to do that. But I am more than happy to volunteer myself. So consider.
Tiffany, thanks, Rob. I think being able to have folks that have the passion that want to do it, and then also just reminding folks who maybe aren't here right now to ensure we don't miss their voices too. So, yeah, thank you.
Got it.
Wonderful. All right. Is there any, let's see, the other thing, again, just part of our nifty, nice, new formatted agenda. We will have committee reports, which is this nice segue from this conversation. So perhaps at the March 4th meeting, we will have a committee report from the folks that met per this conversation that we're having. So, all right. Anything else to go to the order? All right, folks, thank you so much. We are going to say we're adjourned at 7:07.
Thanks.